Rectangle Health. So with that, let's get it started. Steve, take it away.
Thank you, Jacob. Great to be with everybody today. Many of you have been with us before, and this is yet another addition to our great series that we do together with Rectangle Health. Jacob, thanks for the invitation. Today's focus is money. That's right, hearing yes to the fee. So I have a number of resources today. So grab your phone. I'm going to do this at the beginning and also at the end. So if you want to grab your phone, open your photo app. This is the notes for today, so you can just scan that QR code. That'll take you to a quick download page. Just fill out your information, you can submit, and you will get the download of the notes for today, everything financial arrangements. So it includes some specific notes from what we'll cover today, as well as some additional information that will help you hear yes to the fee. So when I ask teams all over the country, what is the biggest obstacle to getting more yeses to treatment? Overwhelmingly, the number one answer is money. Our perception is that money is the biggest challenge. And we can do we'll do another webinar next month about the most challenging objections, including money and other objections. But what we have found that money is not just the most challenging objection, is maybe the one that you hear the most often, but there's always things that are behind it. What we're going to do today is I'm going to give you 7 tips that will make the financial arrangements piece of what you do easier, so that when you get to the money proposition, that'll be an easier conversation. So this is going to be very comprehensive, a lot of different pieces that you can add to your financial arrangements toolbox to make it more effective. So quick backstory. As Jacob mentioned, I'm the founder of 2 organizations that have to do with today's presentation. Total Patient Service, TOPS for short, which is an education coaching company that works with healthcare practices, including dentistry, to help them hear yes more often from their patients to needed treatments. So we work with teams to engineer the entire patient experience so it's easier for patients to say yes to treatment. And then joined with that is our community of practices all over North America that subscribe to our philosophy of patient service, patient care, called the Crown Council. And Crown Council practice subscribe to this whole philosophy of creating a culture of success in their practice. So on any given day, we're working with thousands of practices all over the country, which gives us a pretty good really pulse on what's going on in America, consumer preferences, what's working, what's not working. We're constantly evolving and upgrading our systems to the things that work. And I'm going to share those 7 secrets today that we're finding work more effectively with patients. So here we go, 7 secrets. You ready? All right, so secret number 1 is stop making it about insurance. I'll give you this drives everybody crazy. We work a lot in dentistry. Everybody complains about insurance, and insurance makes our lives miserable and the whole deal. Yet, when you really dig down and do the analysis, gang, we are making it about insurance if we're not careful. Let me give you some quick data on this. We're going to listen together to some calls to dental practices all over the country. And I want you to listen to what some of the very first questions that are asked to the patient when they inquire about one of the most common services that new patients ask for in dentistry, which is how much is a cleaning, and listen to how these teams respond to that request. We'll just listen to a few of these.
Hi, how much is a cleaning?
How much is a cleaning? Do you have dental insurance or just out of pocket with no insurance?
It would just be out of pocket.
Sure. Are you a patient here at our office, or would this be for a new patient?
That would be a new patient.
Sure.
Hi, I'm just wondering how much a cleaning is.
With insurance or without insurance?
Without insurance.
Can I help you?
Hi, I was just wondering how much a cleaning is.
Do you have insurance or no insurance?
No insurance. Hi, how much is a cleaning?
Hi, it just depends on the type of cleaning that is recommended. Do you normally get cleanings every 6 months, every 3 months?
Every 6 months.
Okay. Are you a patient here with us?
No, I'm not.
Okay, and then it depends on if you have insurance or not as well.
I
Are
do
you
not
working-
have.
Okay, let me just double check to see.
How can I help you? Hi, I was just wondering how much a cleaning is.
Depends on insurance, all those kind of things. What do we got going on?
I don't have insurance.
Have you been here before?
Nope, I'd be a new patient.
The price of a cleaning
With or without insurance?
without insurance.
Okay,
Hi, how much?
you get the idea. All right, so Jacob, here's our first poll question. Nationwide survey based on our research, what percentage of the time when a patient calls and asks how much is a cleaning, does the team respond with, do you have insurance? Just take a wild guess. What percentage of the time in our research, 20%, 50%, 70%, or 90% of the time? You pick. This is just a wild guess of what percentage of the time we
All
make
right.
it about insurance.
I want to call my dentist after this and see what they
Yes,
say.
you should call your dentist and just ask how much is a cleaning and see what they say.
All right. So we had 3% say 20%. No one said 50%. 14% said 70%. And then the remainder, 84%, guessed 90%.
There you go. All right. So survey says, based on our research, yeah, it was 70% of the time. The first question was, do you have insurance? So we create the insurance problem many times because of the first question that we ask. It's not about insurance unless we make it about insurance. So when we complain on the back end, that patients say, well, is my insurance going to cover all of this? Because my insurance, covers 100%. We complain about that when we made it about insurance from the opening bell. The first question we ask is, do you have insurance? It's not about insurance. So there's a whole methodology of how to go about this. But could I suggest that in dentistry, as well as all of healthcare, relationship first, insurance is down the road. It's not about insurance. So I want to ask some engagement questions. So Jacob, can you help me out with this real quick? Will you be my patient?
I will.
So if you called and asked, how much is a cleaning? Here's what I would ask. I would say, well, thanks again for calling. My name is Steve and yours is?
Jacob.
Jacob. Great, Jacob. How long has it been since we've seen you? You're going to be a new patient. So
I haven't seen you yet, actually.
fantastic. So you're a new patient. How did you hear about us?
A friend recommended me, actually.
Oh, fantastic. And that friend would be?
That's my friend Gary.
Gary. Fantastic. Well, we are so glad that Gary sent you our way. What did Gary tell you about us?
He said you guys are the best in the business and you give great cleanings.
And he is right. So you have come to the right place, Jacob. So I assume that you called because you want to come to a great place and get the same great service that Gary did. Am I right?
That's correct.
Fantastic. So in order to make that happen, can I ask you a couple of questions and then we'll get you scheduled? Fair enough?
Yeah, sounds great.
Now, I'm going to just stop right there. That took less than a minute. And what have we done? We have established the relationship. We've established a relationship with Jacob based on his referral from a good friend of his, based on what he was told. And I will guarantee you, Jacob, I'll guarantee you that when I ask, what did Gary tell you about us? Gary will never say, well, you got to go to him because they're masters at handling my insurance. I guarantee you that's never why patients refer other people. They do it because of the experience, the service, how much they like the team. I want to build a practice based on patient relationships, not on payment. So as a starting point, there's a whole body of work to do here about how to re-engineer the foundation of the patient relationship. So it's not about insurance. It's about the relationship, about the service you provide, about what you're going to do. You'll help them with their insurance, but it's not about insurance. Make your dental relationship's about just that, about the relationship, not the insurance. Point made. Ask me how I really feel about that, Jacob. So that's secret number one is that insurance is not the centerpiece of the relationship. Secret number two, know what your patient wants. So here is the key. If we're not careful in dentistry, we focus all the conversation around the procedure. And patients don't want procedures. They don't want fillings. They don't want crowns. They don't want veneers. They don't want a bridge. They don't want partials. They don't want root canals. We know they don't want that. They don't really want a cleaning. They don't want an implant. Patients don't want procedures. Nobody in America got up this morning and said, I want a crown. I'm going to call my dentist and we're going to talk about a crown, or I want a root canal. See, we spend all of our time telling patients what they need instead of asking them what they want. So, Jacob, can I use you as an example again?
Of course.
You be the patient, and I'm going to ask you this question. Jacob, for you, what's the most important thing to you about getting your teeth cleaned on a regular basis?
I would say the most important thing is staying healthy.
Really? So health is important to you. Tell me about that.
Yeah, I don't want my teeth falling out. So,
All right. So have you ever known anybody whose teeth did fall out?
yes, my uncle.
What? Tell me about that.
He doesn't go to the dentist. He hasn't gone for 20 years, so his teeth have fallen out. True story.
Wow. Okay. So part of our goal together is to avoid that ever happening to you. You don't ever want to lose your teeth like your uncle.
Absolutely not.
Okay, now I'm going to pause right there. What does Jacob want? He wants peace of mind. He wants good health because he doesn't ever want to go through what he's seen his uncle go through. He doesn't want a cleaning. He wants what the cleaning will do for him, which is that peace of mind, long-term health, keep his teeth. But we focus the whole conversation around the cleaning. What we need to do is focus the conversation around what Jacob wants. This has huge, huge implications for financial arrangements. Am I making financial arrangements for the procedure? Or am I making financial arrangements for health, peace of mind, and avoiding a catastrophic event that Jacob has witnessed his uncle go through? Which is more powerful? Because when it comes to money, we pay for what we want. We will spend our money on what we want over what we need. Beyond food, clothing, and shelter, we do what we want to do over what we need to do. So when we talk about financial arrangements and money, are we including this whole conversation of always going back to what Jacob said he wanted? So this starts early on in the patient relationship. Do I really know what he wants? Well, in this case, I do, with one simple question. What's the most important thing to you about a cleaning? And Jacob, we did not rehearse this. Am I right?
No, we didn't.
So those were real answers from you as a patient, and it was that easy. So you can do the same thing with your patients. So when it comes to financial arrangements, we're helping patients get what they want. And here's what they want. They want to save money. That doesn't mean they want it cheap. We all know, we've all had a buying experience where we didn't buy the cheapest option that was available to us because we know we get what we pay for. We do want to save money and we want good value for our investment. That's a different conversation. So we want good value. We want a great appearance. We want self-esteem. We want to look good. We want to feel good. We want to be able to smile with confidence. We want to save time. We don't want to waste our time. Time today is more valuable to most people than their money. We pay for time. We spend our money to save time. We want trust. We want peace of mind. We want to know we're going for the right place, for the right thing, for the right outcome. We want that peace of mind. We want comfort. We want it to work. We don't want it to ever be in pain. And we want health and quality of life. So these are the things that patients want. So we have to determine, they don't want the procedure. There is no procedure on this list. So when we're talking about financial arrangements, what I'm challenging you to do here is when you're presenting financial arrangements, we're not saying, okay, Jacob, the fee for your cleaning today is this much. What we're saying is, Jacob, you came in today so that you could have the peace of mind of knowing that you're doing everything to have great quality health so you don't ever have to go through what your uncle went through. And so your investment today to get that is whatever it is. Now you might say, but Steve, really? I'm saying really, we got to change the way we talk to patients. They're not paying for the procedure. They're paying for what the procedure will do for them. And this becomes a whole team conversation from the very beginning. Do we really know what the patient wants? And are we helping the patient get what they want? And then everywhere through that patient conversation, we're always taking them back to what they said they wanted. So that question that I asked Jacob is really simple. What's the most important thing to you about whatever you asked for? Most important thing to you about getting your teeth cleaned on a regular basis. Maybe they call because of some other procedure. Maybe they're interested in a smile makeover. Maybe they're interested in whitening. Maybe they're interested in veneers. I'm going to ask the same question. So what's the most important thing to you about whitening your smile? Because it's going to give me the reason why. What they really want. Well, there's a family wedding coming up, or, I'm going out on a date, or I was in a dental office yesterday, Jacob, and we had a patient come in. This is anonymous. I'm not violating HIPAA. CEO, large company, just got divorced. He wants a whole smile makeover. Now, does he want veneers and crowns? No. What does he want? Revenge. So, right, or whatever, you get what I'm saying is he doesn't want the procedure. He wants what the procedure is going to get him, which is self-confidence, self-esteem, and a new partner. That's what he wants. So start talking to patients about what they want, not what they need. It has huge implications on financial arrangements. I can give you wizardry and great words to use in presenting financial arrangements, but if you're plugged in at this level, we're operating at a higher level where you're going to hear yes more often from your patients because you're helping them get what they want. All right, secret number 3, present one fee. Now, I'm going to show you an image of the treatment planning document that comes out of a well-known practice management software, which shall remain nameless. But this is it. Now, Jacob, if I presented this to you as the patient, what do you look at first?
I would say there's a lot going on there.
Yes, there's a lot going on. Like mass confusion for starters.
Yeah.
So when you look at this, you got all these dates, you got tooth numbers, which most patients have no clue what the tooth number is. You got all these codes, which they don't know what any of that means. And then you got all of this Greek language that nobody understands. Core buildup. You got abbreviations for abutment. You got abutment, sup, coarse, fused, and high knob, resin. What? You got all the stuff they can't understand. So you bypass that. And eventually, what are you really looking for?
Looking for how much money I owe. Maybe in that
Exactly.
little box there.
Exactly. So you're searching all over that. And then you know what happens next? You start searching for the biggest number in that list and start asking how you can eliminate it. Well, can we get rid of this? Can we get rid of that? Do I really have to have this? Do I really have to that? This is called mass confusion, and confused minds do not make decisions. Let me say that again. Confused mind. If I am confused, I will not make a decision. You know what I say? I'll think about it. Do they ever think about it? They never think about it. So if you want to align things with how people, more often than not, how they make decisions, could I recommend you present one fee? Let's simplify it. Here's an example. This is what we call it total patient service. It tops the Easy Pay form. your name, what the treatment includes, your total investment, what your insurance savings is, and what your estimated portion is. Simple. So this is a really simple format. Now, if they want backup documentation, the whole deal, you can provide that. But what we found when you present financial arrangements, keep it simple. This is clear and straightforward. Clarity creates velocity, right? So keep it simple, make it really easy to understand. This is what's going to happen. So keep it simple, simplify. If you do what is given to you and you're using the treatment planning form that comes out of your practice management system, you're probably creating more obstacles for financial arrangements than you're solving. Keep it simple. So along with that, here's secret 3A. I have a bonus on this one. All right, Jacob. So I'm going to clean up the language. Here's 3 suggestions. I'm going to give you some vocabulary word changes when you present the one fee. You're going to eliminate the word cost, and we're going to incorporate the word investment or fee because it is an investment. So it doesn't cost, right? This is so the investment, Jacob, for to help you get back in good health, or the fee. So investment or fee. We're going to get rid of insurance coverage because that implies that insurance covers the treatment. It does. Dental insurance isn't insurance. I could do a whole conversation about that. It's not insurance and it's not coverage. It is insurance savings. So your insurance savings. So you'll see on our form, it says your insurance savings is. Okay, so your insurance savings only. So Jacob, here's what I'm not going to say. So Jacob, your insurance will only cover $500. In other words, basically what I'm saying is your lousy insurance will only cover $500. So I'm getting rid of the word only. And again, I'm going to use the word your estimated insurance savings is, because that's what dental insurance is. It really is a savings plan. It's not traditional legitimate insurance. So those are some suggestions. Eliminate those words, incorporate these words instead. That's just a sample of so many terms in healthcare we use that get the patient sidetracked, especially when it has to do with financial arrangements. Okay, secret number 4, third-party financing. Make it easy for patients to pay so that it fits their budget. So let me give you an example. Jacob, if you were to ask any kind of fee question like, well, I'm not sure I can afford that. That's a lot of money. Any type of fee objection. The first thing I would ask you, and Jacob, you be the patient. How would you respond to this if I said, so Jacob, is it the total amount or fitting it into your regular monthly budget that is your biggest concern?
For me, it's probably the overall.
Yeah, overall. So if we could take that overall and we could break it down so that it fit into your budget, would that be something you'd like to take a look at?
Yeah.
Right. So for most people, and it wouldn't matter how he answers. If he said, well, it's fitting into my monthly budget, I'd say the same thing. So Jacob, could we look at some options together of how you could fit this comfortably into your monthly budget? If he says it's the total amount, then I'm going to say, so Jacob, if we take that total amount and break it down so it fit into your monthly budget comfortably, would that be something you'd be interested in taking a look at? And for most people, they're going to say, sure, I'd like to take a look at that. So incorporating third-party financing, as everybody knows, is an essential part of hearing a yes to financial arrangements. So what's your third-party financing strategy? Here's why. Let me give you the data here. So out of 50 million adults, 1 in 5 have some type of installment plan that has to do with healthcare. That's where we are. Healthcare is one of the biggest financial priorities that most people have. And we have migrated to this space now where people expect to have this convenience to be able to pay for it over time, because most people are not prepared for unexpected or healthcare related expenses, maybe that weren't anticipated, more than anticipated. And when you look at that, 1 in 7 are denied access to healthcare because of unpaid bills. So the key, when you look at this, what we know now is that when there are payment options, you get a much higher acceptance, up to 61%, yet more yeses when you have some type of third-party financing in place. So again, we know 50% of adults cannot cover an unexpected healthcare expense of $500 or more. So this becomes an essential piece of your financial arrangement strategy. Now, what I'm going to challenge you to do is to rethink what your strategy is for third-party financing. Because if your first reaction is, well, Steve, yeah, we have third-party financing, but they just don't, nobody qualifies. And if that's been your experience, nobody qualifies or not very many people qualify, you may have the wrong third-party financing solution. So here's the key. In-house financing is a no-no. I don't ever recommend that for dental practices. There's only one thing there's actually a couple I'm gonna show you here in just a minute where I say, yeah, you can do it in-house. Third-party financing, you got to have a really good strategy here where they can have something that fits into their budget. It fits all of these criteria, right? So all of these things, soft credit check, so it's not a hard credit check. They have options in terms of what fits into their budget. It is not, it's not a situation where if they default, then it comes back onto the practice. You can take a screenshot of this. This is all the boxes you need to check so that you have the right third-party financing program in place. All right. So buy now, pay later. So here's basically how it works. Y'all know how this works. You figure out what they need, you check out, they get to choose their payment plan, and then it's paid over time. It's really simple. We experience this in a lot of other places. And even in online shopping today, you have this option. I was on Airbnb last night, Jacob, as an example, looking for Christmas options for my family. And even on Airbnb, they have payment options. You can reserve it now, you pay later, put a down payment down, and then they offer either the total amount due 3 weeks before the visit, or you can pay it out over 12 months. So we're seeing it in online merchants everywhere, right? So the practice ought to have this really, really, really dialed in so that it makes it easy for patients to do, right? So here's the statistics, is that the more you have this, the greater the case acceptance, and the more we're seeing this everywhere in our culture. So that consumers are getting used to this. They're getting used to having these options presented to them. So get your third-party financing dialed in so that you've got a really, really good strategy here. So when we get done at the end of the webinar, we'll give you an option here to explore some different options that you can look at for third-party financing. But it is one of the key secrets for great financial arrangements. Got to have your third-party financing dialed in. All right, so next poll, Jacob, here we go. What forms of financing should you have available? This one's a lay down. I just did this one to make sure you're paying attention and that you didn't run to Subway for lunch while you have the seminar webinar running. So what forms of financing should you have available? None, in-house only, third party, or none of the above. So hopefully we should have 100% on this one. This should be a lay down, should be easy.
All right. We're just one person got it wrong, so everyone else is good. So
all right, that one
98%.
Sleep at the wheel, baby. You got to wake up. Got to answer the questions correctly if you want credit, right, Jacob? Okay. Secret number 5. Here we go. Secret number 5 is signed financial arrangements. So before the patient leaves, we want to make sure that we've agreed on the financial arrangement. They sign off on it, so there's no question about what's going to happen. So this next piece is one of my favorite things when it comes to financial arrangements, is how many ways are there to pay? We've talked about third-party financing, and in addition to that, how many different ways are there that patients can pay for treatment? Let me give you some examples. Obviously, cash. We love cash. We hope everybody can accept cash. That's always a good thing. Checks. So the technology today, every practice in America should have desktop clearing, right? So that you can deposit the checks right there at the front desk. You do not have to go to the bank. Jacob, I think you guys can help them with this, but you clear checks, whether they're from insurance companies or patients, you clear them right there, do all your bank deposits right there at the front desk, saves a ton of time. Obviously, credit card, but it's not so obvious. You know, I run across practices, occasionally they say, well, we don't take American Express, the merchant fee's too high. Come on, make it. Would you rather get acceptance, a yes to financial arrangements, or are you going to nitpick over, you know, a few percentage points? And there's a lot you can do to make that merchant fee a lot more affordable. We'll give you an option here in just a minute on how to do that. So yeah, make it easy for them to pay with credit. And then you can explore if a patient really wants, Jacob, if you really want health, if you really want to avoid going through what your uncle went through, yeah, I can explore all kinds of options with you for treatment. For example, today, you can borrow from your retirement account. You can be your own bank. So I'd even, if we're trying to figure out how Jacob's going to pay for treatment, especially if it's bigger treatment, I'm going to look at options. Jacob, would you be open to exploring some options on ways that other patients have paid for treatment? So for example, Jacob, do you have a 401k or an IRA? Many people are not aware that you can borrow from yourself and pay yourself interest and make money on significant investments you want to make, like in your health, and you're paying yourself to get that done. So that's an option. Flex spending account. Many people are not aware that they can use flex spending for dentistry, not just medical, but they can use their flex spending options for dentistry. If they have a health savings account, I differentiate those because in most cases, flex spending and health savings account, they're different. They'll have one or the other, usually not both. So do they have a health savings account? That's another option. Many people aren't aware that dentistry can come out of that bucket. Here's another one. If they don't qualify for financing, then explore. Jacob, is there somebody who might be willing to co-sign with you so that you can qualify for financing? So always explore that option, or somebody that might want to pay for it for you, right? Always be looking for different options. And then this is one of my favorites. So, you know, I said we're not big believers in in-house financing. Here's one that is a different option. I like to do this for whitening. So the question on your dental health history could say, if you could whiten your teeth for a very reasonable investment, would you be interested? So Jacob, if that were on the dental health history and you checked into the dental office, what do you think most people check when it says, if you could whiten your teeth for a very reasonable investment, would you be interested? What would you check?
Yes.
Of course. Then the chairside conversation is this. I would say, so Jacob, I see you're interested in whitening your teeth. We'll have a conversation about that. And then I'm going to say, Jacob, would you consider $1 a day to be a pretty reasonable investment for a beautiful white smile?
I would.
Oh, here's what we do. This is a really cool program. Is you can get your teeth whitened today, and then it's just $1 a day for the rest of your life. No, I'm kidding. So it's $1 a day. In other words, the total investment for whitening your teeth is, you know, whatever it is. So all we do is we'll just run $30 each month on the credit card of your choice until the balance is paid off. Just $30. How's that sound? Right. So for most people, the cost of whitening in terms of the cost of the office is pretty low. This is the only procedure that I would recommend doing this with. Yes, you can finance it, but this is just an easy way. And there is a way with your merchant processor, they can set up an online credit card clearing where you can put in the patient's credit card information, and then it will automatically then run their card for $30 every month. Jacob, I think you can help them with that, correct?
Yes.
So that's just a fun way for that particular procedure to get more, just more people involved. Whitening is what I call a gateway procedure. You know that phrase? You ever heard the phrase, Jacob, gateway drug?
Yes.
So a gateway drug is a drug that gets you started on other things, right? So this is a gateway procedure. Whitening, everybody wants white teeth. So it's a gateway procedure to more cosmetic work. So I want as many people to get their teeth whitened as possible. What we find, 80% of new patients on a dental history form where that is offered, 80% of patients will say, yes, I'm interested. But yet the average dental office in America only whitens 1.5 smiles a month. A smile, I don't know how you whiten a half a smile, but so there's a lot of opportunity here to make some big gains clinically as well as on the financial arrangement side, right? So explore options, right? That's the whole, yes, sign financial arrangements and explore all the options to find a way to help the patient to pay for what they want. All right, number 6, always have a future scheduled appointment. So Jacob, before you leave, every time before you leave, we are going to schedule your next appointment. So I was in the dental chair this morning, so I have to walk the talk. I am in the business. So I was in the hygiene chair this morning, and before we got done, my hygienist, Vivian, one of the last things she said was, she said, Steve, let's go ahead and schedule your next appointment. She did not say, Steve, would you like to schedule your next appointment? No, it was not an option. She said, all right, so Steve, let's go ahead and schedule your next appointment so we can stay on the good track you're on. And then she went out and she proposed a couple of dates that would work on her schedule. So always have a future scheduled appointment, because this ties into financial arrangements because you always want them coming back. We always want them current with their care. We always want them current with their financials. So if you have a future scheduled appointment and you have all the financial arrangements taken care of, this all works together. So our challenge, my challenge to you today, is to be like the Hotel California. Shall I play it? Everybody remember this? You remember the chorus, Jacob? You can check out any time you like. I would sing it, but I think the Eagles do a better job of it than I do. So here's the goal. Be like the Hotel California. You can check out anytime you like, but you will never leave our practice because you will always have a future scheduled appointment. So that's a whole team effort. It's a big, big part of financial arrangements. We make sure everything is paid for, and we make sure that they have a future scheduled appointment. Get it? All right, number 7 is collecting the patient portion. So this is a key part of getting a yes to financial arrangements, is making sure you collect the correct, it's a tongue twister, correct patient portion when you're right there in front of the patient. So never do we say, well, we'll bill your insurance and then we'll let you know what you owe. No, we're going to collect the patient portion up front, the estimated patient portion based on what we know about their insurance. So we are always collecting. Now, I'll give you one secret to great financial arrangements that impacts the schedule. This is just a little bonus. This is what I call the financial flu. Jacob, do you know what the financial flu is?
No. Tell me about it.
That's when the morning of your dental appointment, and you're going to have a lot of work done, and your patient portion due is like $2,500, and you get up that morning and you feel ill. You have the flu because you do not want to pay that money. So you call and you're sick. That's what I call the financial flu. So Point being, one of the secrets to financial arrangements is separating payment from the date of service. Let me say that again, because most practices aren't dialed into this. Separate payment from the date of service. So if it's going to be major treatment where the investment is significant, and I'd say significant for most people, anything over $500 is significant. You're going to want to separate payment from the date of service. So it would sound like this. Let's say, Jacob, that you're having a significant amount of work done. So what I might say is either we're going to do third-party financing if you need that. If you're going to pay in cash, you're going to pay for the whole amount, then I would say, great. So, and I'd have all this outlined. So Jacob, the amount due today in order to reserve your time for this procedure is $500. And then we'll run the balance on your credit card the Monday of the week of your appointment. That way, when you come in, you don't have to worry about anything other than getting here. We'll get you right in and we'll get started with the work. Period. And then you can program all of that. If you have the right merchant partner, you can program all that in. You collect the money before they ever come in. And I guarantee you they will show up. If it's already been paid for, they're going to show up. If they haven't paid for it, you're running a much, much higher risk of the patient canceling or no showing. So collect the patient portion, figure out what it is. Let's make sure it's taken care of. A whole body of work here to do. So how do you collect the patient portion? Here's a couple of suggestions. So what we know today, especially if in any way, shape, or form, however you're doing collections, or you're collecting the patient portion, if you're chasing money from your patients and they still owe money based on what their insurance savings was, here's what we know. If you're still sending paper statements, you're way behind the times. Nobody opens their mail anymore, it seems like. And so you look at this, we got 78% of medical providers around the country are still trying to collect with patients from patients with paper or manual processes. But yet in surveys with patients, 73% of them prefer to pay their bills online. I mean, when you think about your own bill paying experience, what percentage of your bills do you just go ahead and pay online versus writing out a manual check? And I think you'd agree, if you're like me, I'm paying almost everything online in some way, shape, or form. So how can healthcare do a better job of transitioning to that? Patients want to pay digitally, online, make it easy for them to do that. So here's another survey of over 2,000 patients. 90% of those patients say that their loyalty, part of the patient experience, rests with how they can pay for their bill. It adds to or detracts from the patient experience. 32% of patients said that they would pay their bill in less than 5 minutes if they got a text message. Just make it easy. Make it easy for people to do what you want them to do. Make it hard for them to do what you don't want them to do. So here's an example of a text message. If you got a text message that said, hey, this is Happy Smiles Dentistry. You have a $53 balance due from your visit on December 18th. You can securely make a one-time payment. Click on the link below. Most people will do that. 5 minutes or less, right? That there is a significant number of patients that will do that. So this is what I call the text to pay option. Every practice ought to have this in place so that you make it easier for you can send them a text message and they can pay right there on their phone. You can also incorporate this in your practice, right? So that you can have like a QR code that they can scan so they can get to your payment portal to do that. So there are a lot of ways to do this so that it makes it easy for patients to pay electronically. Okay, so these are examples. You got to have this in place. You can have it on your website so they can click on your website to pay their balance. You can have a QR code on billing statements so they can pay right there. They can scan it. You can post that QR code around your office. You can have it in your emails. You can have it in text messages. So if you've got the electronic payment option, then make it easy for patients to take care of their balance, whatever's due electronically. Okay. And in a critical part, important part of your financial arrangements system. All right. Next poll question. I think this is the last one, Jacob. Best way to
Last
collect
one.
any remaining balance is text to pay, mail a statement, call the patient, wait until their next visit, or go to their house. Oh, I didn't say that. Okay. Hope I made the point.
We'll let the answers trickle in here.
Very good.
All right. I really like my dentist, but I really don't want them at my house. Really don't.
Okay,
Steve.
we'll eliminate that one as an option. You don't
All
want
right,
to
let's
make house calls.
no house calls for dentistry. All right, we had 88% say text to pay, 6% mail, 2% call, and 4% said wait until their next visit.
Okay, pay attention. All right. Thank you for that. All right, so those are our 7 simple secrets to add to your financial arrangements system. There may not be anything more sensitive that we talk to patients about when we're talking about healthcare than their money. And so making sure you have a really sound strategy so the communication is clear, the systems are aligned so that you make it easy for people to do what you want them to do. So as I mentioned at the very beginning, here is a resource with notes from today's presentation and some additional suggestions for financial arrangements. You can scan that. This is from our team at Total Patient Service. So this is a part of the education today in today's webinar. So show notes, if you will, verbal skills, additional systems that you can share with your team to incorporate a more thoroughly built out financial arrangement system for your practice. So a key part of the whole patient acceptance process, we call it being a yes practice. That's what we call it at TOPS, Total Patient Service. So we hope that is a great resource that'll help you get it dialed in. So that's the end of the formal part of our presentation. In addition, you will get, Jacob, I understand that everyone will get an invitation for a demo from Rectangle Health on the different things we talked, third-party financing, buy now, pay later, all of the things that those different things you can add to your financial arrangements toolbox. You do the demo. And do I get to like DoorDash anything I want?
I mean, it's up to you. So it's $100 worth of DoorDash. So Steve, you can just treat yourself to like a really nice platter of sushi just for yourself, or you can split with your office. Up to you.
I love that. Meal of my choice, $100 DoorDash gift certificate for doing the demo. So here would be my challenge to everybody is take the verbal skills that you've received today and the systems, make sure you download the ebook, do the free demo, and look at ways that you can upgrade your financial arrangement systems. Everything from third-party financing, revisit that, text to pay, pay over time. All of those little things make a big, big difference today in the consumer experience. I love that statistic where it talks about loyalty, that how you have your financial arrangements organized is a loyalty factor because it impacts the patient experience. So this is a great opportunity to revisit all those systems, upgrade them. Consumer preferences are always changing. We're always looking at where the consumer is going next. And this is one where healthcare has lagged, that it needs to get up to speed on making the payment part of the patient experience a lot easier. So do the demo, time to crank up your financial arrangements toolbox and take it to the next level.
Yes, absolutely. And thanks, Steve, getting some great feedback here in the comments. So really appreciate the presentation and the time, even though you put me on the spot a few times. But
I did. Thanks for being the patient. I didn't warn you I was going to do that. And you did awesome. I think we give Jacob a big round of applause for being our patient today. And Jacob, I'll do a little plug for our next deal. So in October, we are going to do a special webinar on scary patients. I think this is a Halloween special edition, right, Jacob? So
I think so.
we're going to do how to handle scary patients, which the focus is going to be how to address the most challenging patient objections to treatment. Like, I can't afford it. I need to think about it. How come my previous practitioner or previous dentist didn't tell me any of this? We're going to handle the most challenging objections you get to treatment. So make sure and join us next month for that. Jacob will be sending out a promo for that. But how to deal with scary patients. Costumes are welcome. If you'd like to do a little Halloween celebration for that webinar, we'd love to have you. So thank you, Jacob.
Yeah, so before everyone jumps off here, just a few quick housekeeping notes. As Steve mentioned, we do have that link in the chat if you'd like to book a demo with us. So highly recommend doing that. As Steve went through, the number one thing you can do is have the most options possible that make it easy on your patients. And at Rectangle Health, we do that. So if you don't have things like text to pay or QR code payment, or a myriad of different options, we offer them. So definitely click that button. And if it doesn't end up being a good fit, at least you can have that nice sushi platter for yourself, right, Steve?
See how much sushi can you get for $100?
Exactly. Yeah. It depends where you're at. I'm in Los Angeles, so not as much as you can probably get down there in Texas. But
if you can get sushi, there's some parts in Texas, man. I wouldn't trust the sushi. But.
Yeah, I wouldn't either. And we're going to be sending out a link to the recording, so you'll get that within 24 hours. So be on the lookout in your inbox with that. We'll also contain that link in case you didn't have a chance to scan the QR code that Steve put up there. I'll have that link in the follow-up email as well. And then CE will come to you within the next 2 weeks from Nora Dowling on our webinar team. So just be checking your email for that. And then if there's anything we can do, don't hesitate to reach out. We're happy to help, and really appreciate everyone taking time out of their day today. Steve, thank you as always. Wonderful presentation. And then that survey is going to pop up when we close out here in about 30 seconds. So make sure you fill that out so that we can learn and continue to provide you with the best webinars. So with that, we're going to get you out of here 5 minutes early. I always like to put some time back in your days. Steve, thanks again. And everyone have a wonderful rest of your day.
Thanks, everybody.
All right, take care.